Hello, I'm Dr. Stephen McCarus. I'm a gynecological surgeon. Most of my career I've been involved with training. And I've really worked with thousands of OBGYNs and general surgeons. The one thing that was noticeable with that experience, I've never met two surgeons that operate alike. So if you think about that, how's the patient know her surgeon's expertise? In today's world of transparency and accountability, it's up to the surgeon to explain or show the experience prior to doing any operation. As a matter of fact, that's a position statement for the American Institute for Minimally Invasive Surgery, an organization that I started in 2008. We really wanted to find the best surgeons in the country and ones that would look at the patient's disease and pick the safest, shortest, most inexpensive procedure to correct the problem. Well, the reality is that most women in the United States, especially if they're having a hysterectomy, have really no idea why they need it, and they also don't know what the surgery that the doctor is going to do is. So we have a problem on education, we have a problem on transparency of the surgeon. So the philosophy of Amos was one that was very similar to the philosophy of Docs Connect. Docs Connect is an organization that looks at quality outcomes and quality measures, and in looking at the experience that the patient has with reduction of complications, making sure their physician is vetted, and looking at indications for surgery and the technique of the surgery. So the merger of Docs Connect and Amos seems a likely one, where we share the same philosophies. We look at quality measures and try to meet those measures through data collection from the physician, decreasing costs, looking at the right operation for the disease, not necessarily the right technique for the physician, and also cutting costs through the simplest, safest operation with decreased surgical risk. And then if we look at the patient, educating the patient is so important. So a mandatory second opinion for a hysterectomy seems like to some maybe another step in a hassle of getting a surgery done. But in the reality, it educates the patient and makes the physician accountable for the technique or the operation or the indications to do a hysterectomy. So Docs Connect merging with Amos looks at leadership among physicians, leadership within the patient, and leadership within the insurer or the payer. So working together, we want to save unnecessary surgeries, bad outcomes, reduce complications, increase savings around healthcare dollars, and making the experience for the patient a positive one. As a matter of fact, that's the triple aim in healthcare. So working together, we're going to move the needle in healthcare. We're going to go global with this initiative for second opinions through vetted surgeons, educating women about the procedure and why it's necessary or what options she may or may not have. And then reduction of risk or complications is going to save millions of dollars in healthcare. So we're excited about this opportunity endorsed through the American Institute of Minimally Invasive Surgery, supported and merged with Docs Connect. We are there for the patient, we're there for the surgeon, so we're really supporting and looking at a paradigm shift in healthcare. So thank you for your time letting me explain a little bit about this merger. It's very exciting. I'm very happy to be a part of this process. Thank you.